Hi, I'm Dr. Patty Ferris. I'm a board-certified dermatologist, and I'm your host for this episode of Skincare Confidential. We are so excited today to have Dr. Jim Del Rosso with us. Jim's a board-certified dermatologist. He's definitely one of the most well-known and well-respected authorities on dermatologic therapeutics, and he has lectured and published extensively on the subject of moisturizers and barrier repair, which is what this episode is going to be about. But before we start, I want to tell everybody a little bit about Jim and his accomplishments. Jim is research director of JDR Dermatology in Las Vegas. He's the senior vice president and clinical research and strategic development at Advanced Dermatology and Cutaneous Surgery in Maitland, Florida. He's been in practice for 36 years. Jim, I think you and I are neck and neck on that one. He's a past board member of the American Academy of Dermatology. We served on the board together and had great fun. And he's one of the original co-directors of the fall and winter clinical dermatology meetings, which many dermatologists attend, and they're very valued meetings. Now, what most people may not know about Jim Del Rosso is that he probably could have taken the role of Elvis Presley away from Austin Butler, who I think is up for an Academy Award this year. Jim Del Rosso is an amazing guitar player, a fine singer, and I've heard him imitate Elvis, and believe me, Austin Butler's got nothing on Jim D. So Jimmy D, welcome to Skincare Confidential.
Well, Patty, that's very nice, but Austin, what he has on me is he has looks, he's thinner, and he could move a heck of a lot better than I can, you know. But
I don't know. I'm not sure I buy that, but that's okay. That's your story and you're sticking to it.
Yep.
Anyway,
good.
Jim, we're really excited to tap into your expertise on this subject of moisturizers and barrier repair. And this is a very hot topic right now. You turn on TV and people are talking about ceramides and moisturizers, and you can't go on social media without seeing, derms everywhere talking about this subject. So why don't we sort of start basic with the anatomy of a moisturizer? How does it work? How does it benefit the skin?
Well, I think one of the things that's important to recognize, and just quickly, but I got into this probably in the probably about 2002, 2003, when I was already in my career for quite a while. And I was invited actually by Jim Layden to a meeting. And I didn't know exactly what it was going to be about, but I got to know him. He said, Jim, you're going to love this. And I went to a meeting. It happened to be with Unilever, but it wasn't really about about products. It was all about the stratum corneum and the epidermis, physiology, and then how does it retain moisture and barrier functions. And I'm sitting there and I'm listening to these stratum corneologists, these people that are really getting into the weeds on this, thinking, here I am, I'm years out. I think I'm pretty well accomplished in dermatology, pretty knowledgeable, and I didn't know squat about the basics, the fundamentals of how it all works. So I got into it, started writing some articles, and there's an article in 2011 I'll just bring to people's attention that still has all the basic fundamentals, where I took everything together and try to put it in one place. And I really think what you say about going back to the fundamentals, and it's open access, it's in JCAD. Look under my name, and the second author is Levin, Levin, and you'll find it. You could print it if it's of interest. It gets into actually what the basics are. And with a moisturizer, I think one of the first things is that moisturizers are not formulated to add water. They're formulated to retain water, a moisture level in the stratum corneum, in the epidermis, to help the skin, which has its own ways of doing that, but sometimes it gets compromised, right? It gets compromised either by external environment or by a disease state or both. Like atopic dermatitis is the poster disease, but it's not the only one by far. So I think it's really important, and the formulations have some core fundamental characteristics, but then we start adding in all these designer additives and things that, sometimes they make a difference, and sometimes we're wondering what they're really doing, right? And you've done a lot with that on the cosmeceutical side, especially.
Oh yeah,
right?
Oh yeah. So maybe teasing out the humectants and the different components that people might be looking for. I think that would be very helpful.
Well, I could design a study, and this is where it gets tricky because I think dermatology clinicians, they're getting much more facile, and what is IL-17 doing, and now Janus kinase enzymes or interleukin 4, or, we're getting into the weeds of all this pathophysiology of disease. But when you look at a moisturizer study, you're sort of lost because you never really got that training, right? I could design a moisturizer study to look for something that I want a certain outcome that can in some ways be misleading, because I can show you that something that's truly protectant may be giving the best result in terms of reducing transepidermal water loss over and above another moisturizer, which is formulated to do other things, but it's just not reaching that target within a certain period of time, right? So,
Right.
so I can design studies to pre-design the outcome, pre-figure out the outcome, and that can be somewhat misleading. I think with moisturizers, first of all, we want something that's occlusive in there, and petrolatum, obviously,
Correct.
white petrolatum is the standard. It just sits on the surface and it basically blocks the transepidermal water
Transepidermal
loss. It's a
water loss.
physical block,
Right.
right? But there are several other agents that we add in. There are some fractionated petrolatum that are mixed in with other things like lanolin alcohol and other things, with light mineral oil, which pharmaceutical grade mineral oil, not industrial grade. That's the one that you're going to see is comedogenic or whatever, or some other emollient, protective emollient type agents that can prevent that transepidermal water loss. But that alone is not going to be enough. You need humectancy, right? You need
That's what I was
something
just going to ask you. A lot of
that
people, I think, get confused about humectants because humectants are really bringing moisture from the dermis up, right, to into the stratum corneum.
right. So if you think about, I'm sure you've had this. We've all had this countless time. I'm drinking more water because my skin is dry. Well, if it's getting evaporated out, it's
What good is
it
it?
what good is it? So the skin has a certain amount of physiologic transepidermal water loss, which is normal, and when that increases, that's when it gets into trouble. So it really detects that transepidermal water loss very effectively. But if you're bringing moisture up from the subcutaneous tissue into the dermis, now into the epidermis, you need a certain level. There's actually a gradient in the stratum corneum, but you need a certain water level so that the enzymes, they're hydrolytic enzymes, right? So they need a critical
Right.
amount of water to get desquamation. And we want to desquamate single cells, so nobody's seeing us. But when they
Desquamating.
when when they get yeah, you don't want to be sitting there, in a romantic date, and the person's going, what the I'm watching this
You're
person
shedding. Are
desquamating.
you
Yeah,
molting?
exactly. What the heck is going on, right? Um, that the person might make you sweat, but you don't want them to make you desquamate, right? So if you want to do it physiologically, and when you lose that water level, those enzymes get sluggish, and
Right.
now the corneocytes clump, and that's what we see as scaling, right?
Right.
In dry skin, the scaling is one of the first things that we see. So the humectant, things that we add like hyaluronic acid,
Right.
glycerin, other agents that are humectants, propylene glycol in low concentrations, and some other agents that can be added in. And propylene glycol it keeps rearing its head as a bad word, right? That keeps
Oh
coming up,
yeah.
but it's used. It's
The
used in low
devil. Of course it
concentrations,
is. Of course it
right?
is.
So it retains water in the
The
stratum
stratum
corneum,
corneum.
right? Which is
And then the
where you want
occlusive
it to
lays on
stay.
top and holds it in, stops the transepidermal water loss.
So
So it's a
those
yin
two
and a yang
things,
between those
right?
two is the way I
Exactly.
think of it.
Exactly. And if you only use the humectant and you didn't have the
The
occlusive,
occlusive.
it's not enough because
Right.
you need the fundamental combination of both those things. But sometimes we'll look at formulations and we'll say, why does it have a few different humectants? Because some of these things are now going to be concentration dependent, right? You say, oh, I
Right.
got a great humectant. I'm going to load it with glycerin or glycerol. It's going to get too sticky when the
Right.
concentration. So now
Right.
the really good formulators, who are just like my grandmother, could never tell me how she made her spaghetti sauce. The
Right.
formulators, they don't want to tell you. They keep a little bit back on their secret.
Yeah.
It's like
But you're
Luke's
right. They make
gumbo
it
formula,
they
right?
make it nice, not sticky, and they put those emollients in there to give it the nice slip on the skin, and that's sort of the icing on top of the cake, in my
Right.
opinion.
Yeah, it gives it, but it's just the right amount,
Right.
and so they'll add in other.
Other
Uh, so you have a couple of players in there doing the same thing because when they're together in lower concentrations, they get the job done. They
right.
support each other, but the formulation, you don't have a contact dermatitis level of an
Right.
ingredient or an irritation level or a stickiness or greasiness
Yeah.
of
It
some of
gives that
these.
cosmetic elegance when they
You,
use it
you
together.
we that is the final outcome has to be the person's going to like the way it feels on their skin, and
Absolutely.
if it has a bad smell, forget it, it's gone.
Yeah,
So
forget
so
about it
that's
for right. Talk
those are
about
the
some of the
fundamentals.
buzzwords, Jim. I mean, let's talk about ceramides. You can't turn TV on, can't turn on social media without people touting ceramides. What do those do in moisturizers?
Well, ceramides became a very important buzzword, but a realistic one because within that stratum corneum, you have the corneocytes, the keratinocytes, and the corneocytes, which are the bricks. They talk about them as the bricks, but the mortar in between is the lipids that are organized. It's an organized layer of lipids. But I remember Matt Zyrus at a meeting one time, and he was exactly right. He said, it's not bricks and mortar, it's like bricks and peanut butter, or it's not fixed
Yeah,
like a
like you
block.
think of bricks and mortar.
Right, right. So you think it might be peanut butter or something in there but it's still controlling the water loss there. But ceramide's a significant component of that lipid layer. Now they have to be the right, chain length of ceramides. They're formed physiologically, and in conditions that like atopic dermatitis, they cannot form the correct ceramides. They have a deficiency in the physiologic ceramides, right? They produce
Right,
ceramides, but they're the wrong chain lengths. They're just not functioning as well, in addition to other problems. So that's why the atopic individual, even when their skin looks normal, is losing more water. That's one of
right.
them because they don't. So then ceramides became really popular, and that's where we got most of our data. Suddenly, people were studying atopic dermatitis. They're looking at everything that we're talking about, and atopic dermatitis became the poster
The poster
condition
child, really,
for
for poster
barrier
disease
repair.
for, yeah,
But
for
ceramide,
moisturization.
they're not the only thing. You need fatty acids, cholesterols, you need other components in there. We pay attention now to things that kind of maintain the natural diversity of the microbiome. People are
Microbiome.
getting into these other areas, but functionally, ceramides are not, I don't think, ever going to hurt. There are conditions where you need them more, and they're not the only thing that you need. But
Right.
you're repleting the ceramides so that when the skin is compromised, the, you know, it has to help itself. Like you're flying from New Orleans, you get off the plane in Las Vegas. Within an hour, you could feel your skin getting dry and your nose cracking,
Absolutely.
right? And then you live in New Orleans where you have a lot of humidity
Humidity.
and moisture. So
Yeah.
your enzymes that would normally correct, right, are kind of sluggish. They're kind of sitting back.
They're
They're having
sleeping.
gumbo. They're sleeping. They're going to Pat O'Brien's. They're like, wait, we have to work. We have to start working.
That's
And then, oh,
right.
right. But so
Uh-oh.
they get a little sluggish. But in some people, like atopics, they're not as functional
They're sluggish
normally,
all the
right?
time,
So that's
unfortunately.
so there is filaggrin. That's why we have you talk about another additive, filaggrin degradation products like certain amino acids
Right.
and PCA and some other
PCA.
components
Yep.
that we put in there to help because filaggrin is in the stratum corneum partially that when you need to retain water, filaggrin breaks down into natural moisturizing factor, right?
Right.
And so
NMF.
companies make moisturizers to say, we have components in natural moisturizing factor because that's your body's natural humectant. It breaks
Right.
down the filaggrin into
Right.
several different things, mostly amino acids, some sugars, other
Right.
things, electrolyte, to be the natural humectant, right?
Hmm.
So now you're looking at additives in moist. Oh, so we have, you know, a certain component in here, and we have ceramides. Well, you'll see the
Right.
term. This term throws people off. Pseudo-ceramides. Pseudo-ceramide. It sounds like biosimilars, right? It's
Yeah,
kind of like,
bioidentical.
okay, oh yeah, yeah. Yeah. I don't want the Hydrox cookies. I want the real Oreo cookies, right? But but the fact of the matter is, pseudoceramides. That just means that they made a synthetic ceramide that functions
Like,
pretty much the same as a natural ceramide. Now, people debate, they split hairs, but pseudoceramides, function very well in moisturizers. They're just trying to replicate as much of the natural physiology that they
as
can,
they can.
right?
Yeah.
Right.
Talk a little bit about another thing we hear is kind of a buzzword, thermal spring water. We'll be going through the exhibit hall at the AAD, and there's all the companies that have thermal spring water. And I think a lot of people wonder what the value of those are.
Well, you go there, and depending on where you are, you might have somebody dressed up in a white coat or whatever, and they're giving you now the scientific discussion. So we talked about ceramides can be in a lot of different formulations. It's a good thing to have if you
Yeah,
have a situation like atopy. You can also have ceramides deficient or affected in severe dry skin, in other disease states. So they're not a bad thing to have in there, but they're not the only fix it thing.
okay,
So
agree.
we want to put some other things in there. It's nice, I think, to have antioxidants, ones that
Right,
really do something. We're learning about the importance of that for many, many reasons, right? Um, there,
agree.
there was just a great article. It happened to be with polypodium leucotomus extract, the one that actually has a lot of the data on it, affecting benzopyrenes in air pollution. So it's not
Yeah,
only sun, it's not
agreed.
only using rough soaps and things,
Yeah,
bad skincare products or cleansers, but also the pollutants we're finding more and more and the damage they're creating. So we want to neutralize those things. So I am going to, and I know you've been talking about antioxidants a lot longer
forever,
than I have, because
forever.
I was always concerned that they're in there, but they're not telling us whether they're even getting into the skin or doing anything, right? But now we have some
I
that
think we have
we
some
can
good
talk about.
data to
Yeah,
suggest that they
yeah,
are helpful. And I'm glad you brought up pollution because that whole notion of the exposome, it's not just UV light anymore. We've
right.
got pollution, we've got other things that we have to consider.
Visible light,
Environmental aggressors.
which good antioxidants protecting for darker skin, not
Absolutely. And
only light.
infrared.
Yeah. So yeah, infrared. That's that. With we could go on and on for this forever, but going
We
back to
could.
what you're saying about thermal spring water,
Yeah.
this term microbiome is a buzz phrase, and everybody jumps on the train, right? And I believe there's definitely reality there, but I think we're still learning a lot more about it, and we need to learn a lot more about it because it's extremely important. But a simple example that we know of is people that have atopic skin and then they're developing a flare of atopic dermatitis. And I think it's even true if people are just going from, quote, normal to dry and they're getting barrier impairment. The colonization of the skin changes, and especially in atopics, because they're
Right.
deficient in their antimicrobial barrier. The barrier is
Right.
not only water. The barrier, there's several different parts of the epidermal barrier. There's an antimicrobial barrier. We have peptides that, so if you get staph getting into a little cut or a virus, they neutralize. So they give you
Right.
that immediate innate immunity. So we know that in certain conditions, and certainly the atopic dermatitis, the microbiome on the skin surface changes and you get a lot more staphylococci aureus and epidermidis, right? And then
Right.
all the other organisms diminish in number. So the commensal competition, what makes it hard for a pathogen, you can culture my skin and find something that, oh wow, that shouldn't be there. That doesn't mean I'm
Infected.
infected. That just
No.
means you found it there. But
Right.
you have all these other organisms that are taking up space, and
Sure. taking up food, taking up
right,
space, taking up
right.
everything it needs to be a pathogen.
Exactly. So that
Right.
pathogen comes into the neighborhood, and there's enough other people in the neighborhood say, "Get the heck out of here! You're not going to take over," right?
Yeah.
But then, if you have a situation where that changes and that pathogen's put into a situation where it could bully its way into the skin, right?
Right.
Um, and that is correlated with other things that happen that are tied to a flare. So the diversity of the quote normal microbiome, whatever range that might be, is extremely important. So what they found with thermal spring water in France, in an area of France, is that within that water there were certain concentrations of certain minerals and other components of that water, but it also had a certain microbial um, content that
Component
when
to it.
people a component to it that
Yeah.
when that would be applied to the skin help to normalize individuals that had trouble maintaining enough diversity so they didn't have that pathologic state change
Right.
that we're talking about. So a company there, La Roche-Posay is the
Uh-huh.
company. They harvested a way to basically recreate that environment within some of their moisturizer
Moisturizers.
product, which
Yeah.
is not only the water itself, but also the prebiotic component, where they
Hmm.
can. There's a certain prebiotic component that helps support the diverse microbiome you want, and not allow you know the trouble kids to come into town and influence the neighborhood, so to speak.
Right.
So they did a very nice job with that, and they have good data on it. And
I
that's the thing
agree.
that I would ask, Patty. I don't know how you do it, but there's so many products. It's hard to tell, and I look for at least some core scientific information from a company,
That's exactly why we're
right?
here, and you're
Right?
giving us exactly what we're looking for. I've looked at the La Roche-Posay studies as well, and even had the opportunity to go there and see the patients treated with the thermal spring water. I don't know if you've made that trip over the years, but it's quite an experience. Because we have patients with psoriasis and eczema who are getting nothing but balneotherapy, and it's pretty impressive.
It is, and so you just brought up whether I'm going to go there. We're looking at Miracle on Ice behind me here. I'm hoping for a miracle. Well, maybe I'll get invited one day and I'll get to go. But maybe I'll just go on my own. I'll just
I'm going to put a
pass
plug
pass
in
through.
for you,
All
Jim.
right, thanks a lot. But
Put a plug in.
not to recognize that there are certain companies and there are others. And if I didn't mention somebody,
Oh yeah,
I apologize. But there are certain companies that have spent the time when they've come up with products to talk to
agree.
us why they haven't. Galderma has done it with some of their therapeutic moisturizers for acne. Um,
Absolutely. I
Beiersdorf
think you
has
got
done
to
it
credit
with their
SkinCeuticals on
ectomonas.
antioxidants.
Skin SkinCeuticals on
Yeah,
antioxidants,
done a
exactly.
ton of work.
The people that worked on CeraVe, which was really, I
Yeah,
mean, Cetaphil was the big player, right? And it's
right.
still a very good line, but CeraVe really
It came
worked
in
hard
and
on
took it.
that, and we were there in the beginning
We
and
were.
worked with it and developed it, and they have data behind the product. So
I
ask for the
agree.
data when the reps come in. Ask them to look at it and try to become. If this is not your area, it's hard, like any other new area, but it's worthwhile to just be able to ask and think about a few questions. You'll feel better when you're recommending something to a patient that you feel you understand why, not just that I know I have to give a patient a moisturizer. Like I did early in my career, I'd pick a few, think how it felt on it seems okay, ask my
Yeah, it
nurse how
just
does it feel on you, but not really know what if there were any fundamental um, things that it was doing where there was some scientific evidence. Now, when I recommend these products, I feel good about it, just like I feel good about recommending a medication, a prescription medication, because I understand what it's doing. So it just
right.
helps you feel better and
And
your staff too.
moisturizers are the bread and butter of dermatology. I mean, we are using moisturizers in all patients, whether they're cosmetic patients, medical patients, surgical patients. So I think it's really important for people to understand. I want to, of course, we've
I
been
just want to
jabbering
mention
like we
something on
always
that.
do.
Yeah, yeah, but I feel sorry for the people listening to some extent. But I
Exactly.
guess if they're still listening, they like what they're hearing. But you bring up a very important point. I have to credit the person who trained me, the main trainer, Dave Horowitz, he told me way back when, and we didn't have nearly the sophistication that we have now. He would say to me, do not let a patient leave, regardless, without you giving them something to wash. Everybody wants to know what to wash with, what to cleanse with. Give them a recommendation. You're the
Good.
dermatologist. Where
Yeah.
else, if they can't depend on it from you, who else should they go to? And that stuck with me and it has expanded into what we're talking about now. So
Yeah.
I think
That
it's
was great
fundamental.
advice.
Well, somebody else is going to do it,
Great.
and they're going to give them something we didn't want that patient to use.
Absolutely.
Right?
It's 100%. And a lot of dermatologists, I think, are so busy taking care of sick people that they sometimes don't give the patients the time it takes. And it does take some time for you to go through a skincare regimen.
Right.
There's no doubt it takes time. And, you can have extenders help you with things like that too. But I've always kept that near and dear to me because as you know, I'm such an enthusiast for topical skincare and I love to just tell the patients everything that I know about them. And, I know you do too. You've got so much experience.
And if all you do is say, I'm going to have my nurse or I'm going to have an esthetician come in and you say nothing about it, it loses the sense that it's really important to you as the clinician that they do it, right?
Right.
So I do go through the fundamentals like you do and tell them why I want you to use this exact product and hopefully have something that shows the name of it so they don't get lost with a recommendation somewhere else,
Yep.
with have they see it in a pharmacy, a skincare aisle or a store or whatever. And then, but I have to be on the same page with my staff. But I have a question for you, right?
Sure.
I know you don't mind. Give Patty a chance to get on stage. She's going to rock it. She's going to rock. So when you have
I'm always on
esthetician,
stage.
you're always on stage. So when you have, like, let's say an esthetician, I think a lot of clinicians have an esthetician, but I think they very likely have a disconnect that they don't even know what their estheticians are recommending. And if their esthetician is on the same page with what they think that person needs, maybe because they have rosacea or they have a fundamental skin problem, right? And so that within the office, the recommendations are in harmony with each other, not just an esthetician down the hall that's now selling their line. You know what I mean? So how do you do that?
Well, it's very hard when you have somebody and you delegate it. Personally, I always have kept control of skincare recommendations because I'm such an enthusiast of it. But I do have friends who have estheticians and they use them very successfully for skincare recommendation and, dispensing and keeping products in the hands of the patients. But that requires the clinician to spend the time to educate that person to the level that you and I are talking about. You can't just say, I'm going to give you this line and you're going to sell this line. It just doesn't work that way.
Right.
So it becomes another thing the clinician has to be responsible for. And that is training staff.
Right. And just the same way that you would tell a patient, I want you to use this particular medication, right? And it may be branded, and I want us to try to get the branded if we can. I understand prices. If it's going to fall back on you, let us know. I understand costs for anybody. But when you tell them specifically, this is the cleanser I want you to utilize, this is the moisturizer, this is how you integrate it with your other products, step by step, and you're telling them that specific brand and you're looking them in the eye, that's going to carry a lot of weight with the vast majority of our patients. It's coming from you. I went to see Dr. Farris. I didn't just go see XYZ person in the office.
You're the expert. They're looking for your advice. I couldn't agree more.
Yep.
We have a short amount of time, but I want to ask you a couple of just like one-hitters, one-liners.
Okay, sure.
Some things patients ask us all the time. Do you need a different moisturizer for your face than you need on your body? That's a common question we get.
Not necessarily, but I also sense that there are some people that would be somewhat taken aback when you don't give them that recommendation.
Exactly.
They don't mind having four of my things.
I'm going to put that out there.
And there's a reason why.
Eye cream. That's my next question.
Eye creams could have the same formulation, but they have different concentrations because of different sensitivities on the eyelid.
Correct.
So I do kind of hand select, but there are certainly moisturizers that can be used on the face and the body and even the eyelids. There's
Agree.
some of the basic ones.
Yeah.
Simple
Without additives,
Cetaphil
just
cream,
basic moisturizers.
CeraVe moisturizing
Correct.
lotion or cream, and
Correct.
several others.
Yeah.
Tolerian is a great formulation.
It
There are
is a nice one.
several ones, right?
Yeah. Another question I think we get asked a lot is about layering products. Like, where's a moisturizer fit in? If you're going to put a serum on, then you got to have a sunscreen on during the day. I'm always been sort of the mindset of simple is better, less layering. I don't like to have to put too many things on.
Right.
So how do you sort of manage that in the practice?
So, if I know that this formulation is a very good moisturizer with good sun protectants that I want it to have, that's easier for them to utilize it.
One step.
Just once a day. People might ask, well, am I going to use that at night? They don't necessarily need the sunscreen when it's dark out, right? But
No.
if it's going to be easier for them to get one product, they can do it at night, but they're going to go through it faster. So economically, it still may be better to have one for the day, one for the night, so they're not wasting the sunscreen. Well,
it's nice because a lot of lines do have the AM, PM versions, which makes it really nice. Same formulation, one with sunscreen and one without.
Right, exactly.
All right, well, look, we're going to wrap it because we've taken up so much of your time. But, Jim, I'm so grateful for your expertise. I've learned so much from you over the years. You're one of my buddies. Looking forward to seeing you soon.
Hopefully at another New Orleans Jazz Fest. If that's another story. We could do a podcast
so
on that.
For that. We may just do a whole podcast on that.
Yeah, that's good. So, Patty,
take care.
I feel like we just got started. You got me revved up for the day. Thank you so much. I hope gave some good general insights to your listeners, and congratulations on you and Ted on this podcast. And I'm happy to see you having so much success.
Well, we appreciate your contributions, of course, to the meeting as well as here. Thanks so much, everyone. Have a great day.